So apart from young infants, the first 3 months, as I told you, you need to show irrespective of other symptoms. If there is any degree of fever associated with the refusal to eat or drink and the child seems too ill to drink fluids, so fever can cause dehydration. So if they don't drink adequately, you may get worse. And the other factor is that if they are not even keen to drink because fever causes thirst, it might indicate that they are sick. Their sensorium is affected. So diarrhea or repeated vomiting as well as any signs of dehydration like reduced urine output, if they are less alert and active than usual, then also you should consider. If the child complains of a specific focus, like a sore throat or ear pain, which may mean they have a need for antibiotic possibly, or pain while peeing, which might indicate a urinary tract infection, or a rash in the body. It may be a viral rash, but you need to check for more serious rashes as well, especially if the rash is not blanching. Blanching is the rash changing color when you press on it and release it. So if it's not blanching, it might mean it's like a purpuric rash, K, which is like a blood leaking into the skin. That might mean a very serious problem like meningococcal meningitis. The baby has fever after 24 hours under 2 years of age or after 48 to 72 hours in older kids. Again, you need to seek attention. If these situations arise, we may need emergency care. Which means you don't delay, you don't even wait for the OPD to open the next morning, you take them to the emergency. The child is extremely irritable or fussy with the fever. There is sluggishness and trouble waking up, especially if they are appearing limp or refuse to move. Rash, which I described, purple spots look like K or bruise on the skin. So the glass test, you can keep a glass that we use to drink water on the skin, and if the rash is blanching, you'd see a color change there. It will pale up, and then as you remove the glass, it becomes red again. So this is blanching rash, and the blanching rash is usually less serious. If it doesn't blanch, it means there is a subcutaneous blood leak, which may mean more serious infection. If the child has a stiff neck, there is severe headache or seizure, this is also important. Moderate to severe abdominal pain, because fever can be a manifestation of appendicitis, for example, which may need further evaluation. Urinary tract infections can produce abdominal pain as well. So these are conditions where you may need to review, you may need a test, and according to investigation reports, you may need to decide what to do next. If the child has trouble breathing, especially if there is fast breathing, or the child appears pale or blue, which may indicate that there is difficulty in getting the oxygenation right, this is also an important step, and you may even need to call the ambulance for conditions like fast breathing where the child color is changing, or if the child has seizures or any signs of brain infection.